All right. Welcome, everybody. If you have not already, go ahead and introduce yourself via the chat and let us know if you've been involved in the Strong ACC to date, and if so, how. We're hoping to make this an interactive discussion, and I'll get started in just another minute. Okay, so one thing I don't like is I've still yet to figure out how to be the presenter and share my screen and view the chat at the same time. So before I start the slides, welcome everybody. I think we've got a great crowd today. 24 people have signed in, so thanks for joining us. This is the third collaborative series session of this year for the new Child and Family Health Institute. The Institute was established back in the spring, and our goal is to facilitate interprofessional and transdisciplinary collaboration around child and family health in the areas quite broadly of research, education, program development, service, and advocacy. So this collaborative series builds on the past work of the Maternal and Child Health Collaborative that was organized out of the ETSU Department of Biostatistics and Epidemiology. And when Claudia Kozinets, one of our working group members for the Child and Family Health Institute, retired, she passed the series on to us, and we were very excited to take it on. So I am going to be the presenter today, and I'm going to be talking about the Strong ACC. I do hope that I'll be talking for just a fraction of the time, and that we will have the opportunity for a lot of good discussion. If you didn't already, feel free to chat in an introduction to the other folks on the call and let everyone know if you've been involved in the Strong ACC, and if so, how have you been involved? And just looking through the chat so far, we've got a wide range. We've got folks that have attended meetings, folks that have only become involved recently. We've got quite a few folks that have been involved from the beginning and attended lots of meetings, as well as people who have not been involved. So I am going to start out by kind of getting us all on a level playing field here and describe the evolution of the Strong ACC, but hope to provide at least half of our time to discuss how ETSU can be engaged in the Strong ACC initiatives. So I'm going to go back to sharing my screen, hopefully here, and put this in presentation mode. So our goals for today, like I said, describe the Strong ACC and its current priorities, discuss opportunities for participation and collaboration in Strong ACC initiatives. And then what I hope to have a discussion about is how different units within ETSU can create action plans for participating in these Strong ACC initiatives for the next year. So this strategy period we've used the Strong ACC to help us think through why the ACC is needed, in what ways or how we want to bring about change in our region, and then specifically what we need to do. So I'm going to go through our mission, focus areas, our strategic focus, and then talk about our initiatives and priority initiatives for year one, give some examples of proposed activities that member organizations may take on, and hopefully hear from some of you about the activities you're thinking about, or, you know, maybe think would be good for someone to take on. And then, of course, we'll talk about how we're going to measure success. So what is an accountable care community? An ACC is intended to positively impact population health by integrating public health, healthcare delivery, social services, and businesses. And this certainly in our region includes the field of education and educational organizations and faith-based organizations. And one of the main goals of an ACC is to help these different sectors work collaboratively and break down traditional silos that we tend to work within to tackle health problems, tough problems in populations. So particularly if you work in the healthcare field or tuned into that, you may think more about an accountable care organization, and an ACC is different than an accountable care organization. So unlike an ACO, which intends to address population health through a healthcare perspective, an accountable care community intends to address health from a community perspective. And this is a model that's been promoted by the Centers for Medicaid Services and the Centers for Disease Control. So we are using multi-sector partnerships to emphasize shared responsibility for the health of an entire community or region, and hope to design systems that are successful at addressing social and economic factors and improving population health. And we recognize that social and economic factors in health are very influential on each other. An ACC creates a shared vision by establishing a leadership structure, and I'll talk about our Strong ACC structure, prioritizing health outcomes. Many folks on the call have participated in meetings over the past few years where we as a region have brainstormed health issues and prioritized them. Developing and implementing strategies to integrate and coordinating services. So over 2019 and 2020, we did a lot of strategic planning through the ACC. Sharing data and then utilizing a comprehensive strategic planning process. So once again, why does it matter how we approach health improvement? Well, this slide shows contributions to health and what we spend on being healthy. So as you can see, about 70% of what makes us healthy is the environment and health behaviors. Social determinants of health, things like education, income, access to food and safe housing, violence or the experience of trauma. All those things influence our health. And only about 10% of what makes us healthy is based on our access to health care. However, in the US, what we spend to try to make us healthy, about 88% of that is spent on medical services, and only 4% trying to promote healthy behaviors. So the Strong ACC has been evolving over several years, of course, with the Ballad Health merger in 2018. They, through their new creation of the new Department of Population Health at Ballad, were able to take a leadership role in establishing the Strong ACC and provide some backbone support and resources for its creation. We have over 250 organizational members in the Strong ACC. So individuals don't become members in the ACC, but individuals representing organizations do. So we've got many members who are representing organizations in the Strong ACC on the call today. This is, to our knowledge, the first ACC that spanned 2 states. Northeast Tennessee and Southwest Virginia is the population that we're intending to serve. And that covers 21 counties. And so through inclusion of all these organizations, we're hoping to, and have been, mobilizing the community, coming together to have shared accountability for health in our region, aligning our resources, and then following a model of collective impact to impart change in the region. And if you're not familiar with the collective impact model, this includes having a common agenda, shared measurement, embarking on mutually reinforcing activities, having continuous communication, and then a strong backbone. And as I mentioned, Ballad Health is our regional backbone organization for the Strong ACC. Initially, Healthy Kingsport was a backbone organization, but due to leadership changes there, they are not currently serving as a backbone support, but United Way of Southwest Virginia is our backbone support for the Virginia side. So like many of you, I was invited to stakeholder meetings and focus groups over the past few years to help guide development of the Strong ACC. And then in late 2018, I was invited to join the Leadership Council. So we have a Leadership Council that includes a dozen representatives from Northeast Tennessee and a dozen from Southwest Virginia that form the Leadership Council. We also have a metric and evaluation committee, again, since shared measurement and monitoring data is a big part of achieving progress with an ACC. We have a multi-sector organizational membership. And in 2019, we met within sectors to do strategic planning and brainstorming and develop strategies and initiatives to take on as a Strong ACC. And so we were meeting within these sectors of health and healthcare, education, business, and then community and faith-based organizations. So many of you on the call may have participated in those sector committee meetings where we did a lot of that brainstorming and planning. So once again, through these regional focus groups, community needs crosswalk of those and input from a really diverse group of multi-sector stakeholders. Initially, we identified 4 priority areas for the Strong ACC. And so we took kind of what are often referred to the big 3. So substance abuse and misuse, tobacco use, and overweight and obesity as priority areas. But based on input from stakeholders in our region, a 4th priority area was added, and that was childhood trauma and resiliency. Our mission statement. So this was developed through input from at stakeholder and member meetings, and then kind of finalized by the Leadership Council. And it's a mission statement that we've been using mostly internally so far. The Strong ACC will identify, align, and leverage regional well-being efforts aimed at recognizing the connection between education, income, and health, and seek to create a healthy population by serving people of all ages, making sure to include those who are at risk. Our focus areas. So we have a life course approach to four focus areas. So Strong Starts, that covers conception through kindergarten. Strong Youth, kindergarten to 12 years of age. Strong Families, adults and caregivers. And then Strong Teens, that's 13 to 18 years of age. And again, our ACC recognized the interconnectedness of educational success, economic vitality, and healthy lives, and that all three of those are really important and interconnected. The strategic focus of the ACC, overall, what we decided is that regional resilience is our kind of overarching theme and strategic focus. So, as I mentioned, meeting in those sector committees, ACC members representing those 250 plus organizations in our region identified strategies. And then this past year, our Leadership Council took those strategies and went through a prioritization process and took all the information that came out of those 4 sector committees and compared and contrasted and summarized them. There was lots of overlap in terms of what each sector thought the ACC should work on. So we pulled that all together into our list of initiatives. And here they are. I'm gonna go through these quickly just so you can see the breadth of what the Strong ACC hopes to address in the coming years. But then I'm going to focus in on 4 of them. And those 4 were prioritized since COVID-19. So obviously, COVID-19 has impacted our region, ourselves, our communities and organizations within the ACC in ways we could not have predicted. I think it's actually really fortunate that we were already on this road to establishing the Strong ACC because we need it now more than ever. But we really felt like we had to prioritize our initiatives and where we're going to start so that we would start out in a manageable way and focus on initiatives that we felt were most relevant given the times that we're living in with COVID-19. But just to give you an idea of the breadth of what we want to do with the Strong ACC, here's all the final list of initiatives that came out of the strategic planning process and prioritization. So create a system of coordinated care, a no wrong door approach through use of community resource inventory and community referral technology to really help us address those social determinants of health. Create a data dashboard on the ACC website comprised of community data. Conduct regional asset mapping for communities to use in developing programs and interventions. We hope to create a regional speakers bureau to assist organizations and communities. We talk a lot about needing a regional transportation solution. That's definitely on the list. Create a hub of resources, tools, and best practice policies for businesses to aid them in addressing topics like recovery, family-based programming, childcare, and others. Expand behavioral health programs for workforce growth across the region. Implement and expand integrated behavioral health in school systems and primary care settings. Provide training on adverse childhood experiences, trauma-informed care, and mental health first aid and resilience to multiple sectors, and specifically school systems. We're about halfway through our list. Here's the other half. Increase ACEs screening and early detection across sectors. expand affordable and quality childcare, enhance supports for childcare sites and providers, and provide training and coaching opportunities for early childhood. Expand mentoring, coaching, and quality after-school programs across the region. Provide caregiver and parent coaching and training. Promote healthy behaviors, including nutrition, self-care, discouraging tobacco and vaping and distracted driving. Provide life skills, soft skills, and workforce training opportunities. And expand internship and apprentice opportunities across the region between schools, academic programs, and local businesses. And finally, provide long-acting reversible contraceptive education and services to teens. So since COVID, the Leadership Council went through a prioritization process and then verified their choices with the full leadership. And these were the 4 initiatives that were identified as priorities for our first year, or for the beginning. So create a system of coordinated care, that no wrong door approach. Create a data dashboard on the ACC website of community data. Provide training on ACEs, trauma-informed care, mental health first aid, and resilience. And then promote life skills, soft skills, and workforce training opportunities. So all of the individuals representing member organizations in the Strong ACC were asked about a month ago to develop an organizational activity plan for their organization. And ETSU is a very large member organization, and we actually have individuals that represent a couple dozen departments, colleges, units within ETSU who are members of the Strong ACC. So we're not just one member, we have lots of members, again, since we're such a large, diverse organization that, of course, provides education, delivers healthcare. We kind of have a foot in each of those 4 sectors that I mentioned to you. So ACC members have been asked to submit their plans by the 15th of this month. It's just in a couple days, to Paula Masters. She is sort of the leader from our backbone of Ballad Health that has been facilitating development of the Strong ACC, along with Travis Stanton from the United Way of Southwest Virginia. And each member of the Leadership Council, remember I said there's 24 of us, volunteered to assist a dozen and a half or so member organizations with completing their organizational activity plan. So several folks that I volunteered to assist are on this call. Again, we're providing that outreach and support from the Leadership Council. And I don't think I introduced myself in the beginning, but I've kind of told you who I was throughout this presentation, but I'm also, a professor and a general pediatrician in the Department of Pediatrics here at ETSU, and the director of the Child and Family Health Institute here at ETSU, in addition to being a Leadership Council member. So these organizational action plans are to help each organization or each unit within ETSU figure out what they can do, what sort of mutually reinforcing activities could they take on to align with these ACC priority initiatives for the next year. And, how do we want to partner and collaborate? They are intended to really lay those activity plans out in a little bit of detail and with some specificity that'll help us keep accountable and engaged. And then they'll be submitted so that we'll be able to track these as an ACC. So the parts of the plan that our ACC members have been asked to write include their action steps, who their leader and team members are going to be responsible for carrying out those action steps, when they're going to start and complete their activities, what metrics or milestones they want to look at to measure success. And then what support is needed. So this, I think, is an important part of what you want to include in your plan. And that might be internal support from within your unit or organization or from within ETSU, as well as external support that might be needed. So what we'll do for the next half hour, and we will have, I guess about 7 minutes for each initiative, is we're going to walk through these one at a time and discuss them. So No Wrong Door, the community data dashboard, ACEs and resilience, and then workforce development. And I definitely will invite everyone on the call to, unmute yourselves, chime in, chat in if you want, ideas and comments, and then where you think ETSU can play a role. And Katie, if you could kind of help me keep an eye on the chat. Again, I don't know how to see it when I'm in presenter mode. So let's start out with this coordinated care, no wrong door approach. So the activities listed on this slide came from all the many meetings that we had with ACC members and within sector committees. And so these are some of the activities that things that they thought should be done in the region. Now we want to see, well, what organizations are going to take on which of these activities. So one of the first things we wanted to do was research best practices for community referrals and supporting technologies. Create a hub and spoke model that encompasses all ACC organizations and partners. Educate people on a coordinated care approach and creation of a community resource referral inventory. So we've actually been working on these 3 things. And I say we, folks from Ballad and United Way, members of the Strong ACC Leadership Council, we've been vetting 4 different community resource referral technology platforms, 4 different software platforms that we will use potentially to help with coordinating care, specifically around social determinants of health in the region. We reviewed 4. We had the vendors come and present them and demo them. And everybody's been, in the past week or 2, kind of identifying their top 2. What we hope that these will allow us to do is that all the members of the ACC will be able to participate in using this technology, either to help refer a member of the community or a patient or a student who has a resource need and help connect them to resources in the community, or perhaps receive a referral. If we have a resource that an individual might need, this technology will allow us to communicate electronically, make those referrals, get all the necessary consents that meet HIPAA and FERPA regulations, and then close the loop on referrals. So, I'm a pediatrician, and in healthcare, sometimes we'll refer a patient for a service, and then we may not find out if that referral was completed until we happen to see the patient again. These technologies allow for closed loop communication. So if we have all these different organizations in the ACC and in the region participating, we hopefully will have a really effective and efficient way of connecting people to resources in our community, and then tracking those referrals. So we haven't picked a platform yet, but one will be identified hopefully in the next couple months. Once we identify one, they take a couple of months to get up and running. One thing that each of these technologies includes is some kind of resource inventory, but that's something that all of our member organizations are going to have to contribute to maintaining and updating and make sure we have all the resources available for our region in this community referral technology. So other activities, we want to align navigation across organizations. So, you know, a lot of healthcare organizations have care coordinators, case managers, community health workers. We want to coordinate those individuals in using this community referral technology and accessing the resource inventory to better coordinate care across the whole region. So I think I've covered most of the activities here on the slide. Here are some of the outcomes or metrics that we want to measure for this initiative. First of all, we want to look at how effective this tool is, the referral platform, how many agencies become part of this No Wrong Door initiative. We've even talked about designating organizations or agencies as No Wrong Door if they're participating in this activity, just to recognize their participation and contributions. Number of agencies trained on this hub or technology. Then in terms of outcomes, we want to look at frequency of updates and how well we're keeping our community resource inventory current, whether those are resources, again, for food, housing, transportation, mental health, and others. Other outcomes that we would look at, reduction in the number of ED visits, reduction in the number increase in the number of clients reporting easier access and awareness of services. And then in terms of impact, we want to look at how well we're conducting those mutually reinforcing activities and meeting the needs of the population. So I am going to pause there and I'm also going to stop sharing my screen so I can see everyone and sort of see the chat if anybody chats in questions. But any thoughts on how ETSU might play a role in this initiative for coordination of care?
I have something. One of the struggles that we've had historically, or at least with the SBI, is figuring out what to do as a higher institution of higher education. So like in the Department of Pediatrics, you have pretty specific objectives, healthcare objectives, but certainly in the Department of Psychology, we don't have direct, care objectives. We have training objectives, and we train behavioral health experts in psychology, and we have 600 psychology majors, and so we have undergraduate curricula. But it seems to me that, and I know that Kelly Moore has, I don't know when we're meeting, but it's pretty soon. It's tomorrow. Is that we ought to come up, I believe that we ought to come up with a global emphasis rather than spread out across all of our individual departments, because if we're not going to represent ETSU, then we're representing our individual units, and the impact is going to be very different. And I don't really see a direct relationship between the Department of Psychology and the Strong ACC, other than we're happy to train as many primary care behavioral health psychologists as you want. But I think what we ought to do is leverage our educational place. And I don't know if that means undergraduate education or what, but it ought to happen collectively and collaboratively across all of us, which, you mentioned that there was a dozen or more of us from ETSU on the Strong ACC. That means we all get together and come up with some objectives. I know you put one together for pediatrics, but and that's great, but I don't think that, it's like, that's probably easier for you to do than it is for me to do, and others who are on the call. So I think that we ought to do what Kelly's doing and centralize and collaborate and focus and leverage our educational mission in health throughout this region.
Well, and I think that's a great idea, and that was really one of the goals of this meeting. And I really appreciate Kelly Moore. She's gotten together some of the ACC members from ETSU in a second meeting tomorrow to discuss this further. Like Dr. Dixon said, I was able to come up with a draft plan, and I can show my screen so you guys can see what it looks like for ETSU pediatrics. And then I've discussed that with some folks in our clinic. But, you know, how can we mobilize and coordinate across ETSU? So the Child and Family Health Institute, I think that is a role that we would love to help play. I'm going to put the organizational activity plan that we've worked on so far in pediatrics. And I will say some of these 4 initiatives may resonate with certain units within ETSU more than others. You don't necessarily have to propose initiatives under each activity plan, but I really like the idea of pulling what we all come up with for our organization into an overarching ETSU plan. Just put that up on the screen so folks can see it. Anybody else have thoughts about how ETSU or your unit might contribute to this care coordination, no wrong door initiative? So, you know, the example I gave from our clinic, in our pediatric clinic, we have for a couple decades now a team-based care approach. So we have psychology and social work in our clinic. We also, in a couple of our multidisciplinary clinics, have physical therapy, occupational therapy, speech therapy. We, in our general peds clinic as well, we have nutrition, we have audiology, we have counseling, we have lactation. We've got a number of different professionals in our clinic. But our behavioral health and resource team, our psychologist, Dr. Matthew Tolliver, and our social worker, Brandy Johnson, their team helps to connect our patients to resources in the community and helps to deliver some of those resources in counseling while patients are in the clinic. And the way that we've worked with that team in recent years when we start a new project is to form a champion team. So for our plan, thinking about pediatrics and how we might engage in this No Wrong Door initiative, you know, one of the first things I thought we do is form a team within our unit and then educate ourselves on this new community referral technology and think about, well, how will that fit into our current processes and protocols? Can we replace some of the things we're doing by using this community resource referral technology? You know, and obviously there'll be more information coming about that. As Dr. Dixon mentioned, we're all educators, and certainly we would want to educate our providers, and that would include our trainees on social determinants of health and care coordination. I then have in there an implementation step and an evaluation step. So just showing that as kind of an example of what one of these organizational action plans look like. Any other discussion
Karen,
about care coordination?
Karen, could I interject something?
Absolutely.
This is Dave Wood. I was thinking more about the focus on youth and having maybe the folks at each, I mean, we have a unique resource. We have literally hundreds of youth that are, 18, 19, 20, but also we have many departments that are interested in services to youth, from education to social work to psychology to pediatrics and everything. And I'm thinking maybe those that are interested in the youth and emerging adult kind of age group could come together to look at how we could make this resource directory youth friendly form maybe a youth advisory council, even come up with some creative ideas to outreach to youth using social media so they could be aware of services and other things that the ACC wants to do targeting youth. And maybe we could, be a leader in trying to pull in other organizations that are serving youth, like DCS, like the courts, like the high schools and the middle schools, and try and identify really important aspects of health and healthcare. And one of the things I think we really innovative and interesting to do, and we did this in Jacksonville when I was there, is take the youth risk behavior survey and make it local, and get funding to do an annual or every other year youth risk or other youth-oriented survey through our schools using their protocol and format to kind of give a report card on how youth are faring in our region. I think that would kind of put the focus on youth in a very unique way. And we in Jacksonville, we actually had a lot of initiatives come out of that survey because it educated the public about the issues facing youth, such as suicidality or vaping or these other things that are sexuality and sexual activity, these things that are really kind of under the surface of our youth population. And I'd love to see us have maybe at ETSU, we could bring together the folks that are interested in that age group. That's my suggestion.
Well, and that's a really good segue into this second priority initiative, which is to create a data dashboard on the ACC website comprised of community data. And this effort has also already been underway. I mentioned that we have a metrics and evaluation committee that was established as part of the Strong ACC. They have been working with the ETSU Center for Rural Health Research, and I know we've got some folks on the call from that center, and I certainly welcome you to comment. I think we've got some folks who've been part of the metrics and evaluation committee as well. But the goal here is, like Dr. Wood gave a great example, is we want to identify and collect consistent local data and share it and promote its use with all the members of the ACC. By creating a dashboard that would be available on the web. It would include data from both states in our region. And we'd want to track the number of organizations using or contributing to this data. And use the data and increase awareness of community level issues, and of course, guide our programming, improve our quality in the region. So I'm going to stop sharing here, but I did want to see if there were folks, and I know there were, who are part of the Rural Health Research Center. I see Kristen is here, and I think you may have been part of the Metrics and Evaluation Committee as well. And I think, one of the comments I saw was about research. Just like we are positioned to help with training and education, I think our institution is positioned well to help with data and research, and that there's certainly going to be opportunities there for research proposals.
Yeah, Karen, in that vein, I think it would be, and I don't know if this would be the same data set, but it would be nice to have kind of a central repository, so your PhD students that sometimes come in with a broad idea, but don't really have a place that they can either implement their project or their study, to have somewhat of a sorry about that. I just got kicked off. I live in the country and that is life.
That's okay.
But anyway, to have a repository for what projects are going on and, you know, where there might be opportunities, particularly for student-oriented research and projects. Just a thought.
Yeah, I think that's a great idea. Let me go back to sharing my screen. So as I mentioned, this data dashboard is in the works. And I think as you mentioned, I think it would be well aligned with ETSU's mission and the Strong ACC mission to include as an activity, Valerie, how can we make data that's being collected and perhaps going to this dashboard available as a training opportunity to provide access to data and projects to our trainees. I think that's a great activity to propose. We will move on in the interest of time to ACEs, trauma-informed care and resilience. So as I mentioned before, there was certainly a focus in doing this in organizations and providers throughout the region, but also in schools, in particular with early childhood educators. One idea was to create an inventory and sort of a baseline. Where are we in terms of training in schools and educators? What organizations in the regions have already been trained in ACEs and trauma-informed care? We thought it would be helpful to create a training program that will help to create awareness, have common language in an evaluation process, and make this accessible across sectors. We're going to need a communication plan here to really socialize training, get the word out on what are ACEs, what is trauma, what does resilience mean, why is this important? We've got a number of people who've been trained in the region. We want to expand our trainer capacity so we can continue to expand training in the region. We're going to need to get buy-in from different organizations and sectors. And one idea was to create regional trauma-informed teams that can partner with schools to provide mental health resources and training to school personnel. Some of the metrics we want to track, again, number of organizations or individuals who've been trained. Of course, child abuse, ACEs are comprised of abuse, neglect, and household dysfunction in broad categories, number participating in child abuse prevention courses. Some of the outcomes we might look to impact: number of DCS referrals, number of children entering foster care, again, number of unnecessary ED visits. Can we reduce substance exposed birth rates or NAS? Can we improve third grade reading level by increasing children's resilience? So Dr. Dixon's on the call, and I want to give him an opportunity to talk about the Strong Brain Institute.
Okay, thank you. So the Strong Brain Institute was really the brainchild of a group of ETSU faculty who are all interested in ACEs. And, you know, at that time, we probably numbered around 11 or 12 people from about 5 or 6 colleges on the ETSU campus. Now we have 20 some members from 11 different academic departments, and all 8 academic colleges, and members of the community. And we have 2 employees also. But the Institute couldn't have been created without a really cool $1 million gift from Ballot Health, which to my knowledge is one of the rare health higher ed town gown collaborations to address ACEs. I can read our mission statement, which is: the ETSU Ballot Health Strong Brain Institute strives to be the preferred resource for promoting the awareness and empirical study of adverse childhood experiences, for promoting the development and dissemination of evidence-based practices that prevent, reduce, or mitigate the negative effects of ACEs on health and health disparities, and for promoting a trauma-informed citizenry and workforce in the Appalachian Highlands region and beyond. Our key goals right now, we're moving in two directions. One is to work on trauma informing ETSU, and we have one team dedicated to that, but we have another team dedicated to, we call the curriculum team. And our objectives are multi-pronged also, but one of our objectives is to create training available in the community, both at the general level, which we've been calling internally as ACEs 101, but then sector-specific training beyond that, which would include like the legal system, healthcare settings, school systems, the police department, and others, any others that we can think of. And so we have about 6 or 7 sort of secondary sector-specific trainings that we're thinking of rolling out probably in late spring. But one of the other things that we do is try to ensure fidelity. So when we have all these trainings, and Karen mentioned the goal of ensuring competence in ACEs understanding, it's really important that we validate trainings and that we produce science on it to make sure that when we say we train people in ACEs, that we're fidelitous to that training mission and that people actually learn what they say they learn. So we're not just going to do training, we're going to study the training. And so we're going to have a dissemination implementation component. And also we want to serve as a consultant for program evaluation for our agency partners who are developing their own sort of ACEs informed approaches. We've formed an advisory council, which right now is going to be chaired by Margaret Fire-Robin from Bristol Connects, former mayor of Bristol and also member of the Bristol City Council. And a total of 12 people, including a member of the General Assembly, David Hawk, Judge Sharon Green of Johnson City, Child Courts, and several others who are going to guide us moving forward. So you should know that we're out there. You should think of us for anything ACEs related. We have a ETSU training scheduled for next Tuesday, 11 o'clock to talk about virtual resiliency. Like on a call like this, like should you have your cameras on, should you have your cameras off, what should you put in the chat, that kind of stuff. And also one for the community, which is the following Tuesday, the 24th of November at the same time, 11 o'clock. So you know, if you want to find out about those, there's a link. I posted the link in the chat if you want to register for the community town hall. But if you also want to register for the ETSU town hall, well, you have that one in there. Actually, I think that's the one for the community town hall. That's on November 24th.
Oh, okay.
But I can send out to the ETSU town hall.
Chat with the correct link.
Okay, thank you.
Well, and I'll make that correction in the slides because we do plan to send the slides out to everyone. So we'll make sure you have the correct link. I want to at least mention this last initiative because it's definitely relevant to us as ETSU, and that's to provide life skills, soft skills, and workforce training opportunities throughout the region. And so some of the activities that were proposed are to first of all, evaluate best and promising practices and programs that might even already exist in the region that could be disseminated. Define what life skills are for students and parents, do some focus groups and engage middle school and high school students to assess needs for teens. Are there apps out there that could be used to help promote life skills? Again, create an awareness campaign, train local educators and after school programs on teaching life skills. Reach out to employers to get their buy-in and facilitate having employers visit schools to educate and engage kids. Engage outside entities with schools to encourage more training and exposure to future careers. Put together a life skills toolkit. those are some of the activities that were proposed. Some of the measures we want to look at: number of schools offering life skills training, number of students receiving it. Outcomes we want to look at: teen employment, number of students receiving work readiness certification, teens who are college or career ready, and look forward to impacting school attendance, high school graduation rates, teen births, students entering higher education, median income rate. So clearly there's a role for ETSU in that initiative. Dr. Wood, I don't know if you're still on the call. It looks like he stepped off the call, but he had emailed me with a number of ideas for engaging adolescents, because he practices as an adolescent medicine physician and has been involved in partnering with schools and trying to establish school-based health clinics in the region.
Karen, I was wondering, I am in Haywood County in Western North Carolina, very similar issues to the Johnson City area. We actually, here in Canton, where I live, have had a kind of community-focused effort. We call it EACH, Ending Area Childhood Homelessness. And it is a collaborative between the churches, various volunteer groups, Habitat for Humanity, etc. But we actually, our Rotary Club, our local Rotary Club, who was composed of, a lot of local businessmen, they actually took up the mantra of job training and financial management training, and actually worked with the local high schools to go into the schools and start to provide resources to teach the information that kids, even in a middle class, upper class family, they don't get this education in high school, which is how to balance a checkbook.
Right.
And when you buy the big red truck on the big tires that you have to have a ladder to climb into, that, you got to put gas in it. You got to pay for insurance. Our church is just moving a family that we have been working with for 3 years. We have a duplex transitional housing, and they are moving into their Habitat house this month. So the model has been, it's kind of one family at a time, but it's been very effective. And, Rotary and those types of clubs, Lions Club, seem to be very interested in joining with these efforts.
Well, that sounds like a great model and example that we might want to look at further. Sorry. I know we're out of time, and I hate that we're out of time, but we want to find ways to continue this conversation. And would love more input on, approaches and models that we could take on and expand in the region. So if you have any questions about how to get involved, feel free to email me directly. This slide just kind of shows the next steps for the Strong ACC. We're going to be getting those organizational activity plans together, launching that data dashboard, also purchasing one of those community referral technology platforms. So I think that'll help us know more specifically how to be engaged once we've got those as a baseline. We are going to be changing our committee structure to be more focused around these 4 initiatives. We're going to have committee meetings that members can join and participate in on a monthly basis. All member meetings will happen quarterly. We're going to have learning sessions related to these initiatives throughout the year. And certainly new member organizations are welcome. We're also looking for 2 new leadership council members, and a position for an ACC director has been posted. So thank you all for joining today, and we'll get the slides out to the group and those trainings that that Dr. Dixon mentioned through the SBI. And sorry, we went a little bit over. If anybody else has